3 minutes after 2, and I welcome everybody to the ACEs Aware Kings County Network of Care Power of You meeting that we have on a monthly basis. We're very excited to be here today, and we have a great presenter. The Kings County ACEs Network of Care sessions are a series of monthly interactive sessions that offer opportunities to share practical information to improve the network of care and help mitigate trauma ACEs in pediatric and adult populations. Participants will also have the opportunity to amplify their knowledge and gain access to social and community resources, which we will have available for everybody today. So welcome everybody, welcome to the Network of Care. Just some housekeeping notes as we move forward. The webinar is being recorded. So there's two things that are going to be available for you after the end of this presentation. The recording of the presentation will be available, as will be the slides that are going to be presented. So if you'd like to see the recording again or pass along the recording to somebody who has not seen it, we can give you the link. It will be on the KPFP or the King's Partnership for Prevention website. Next order of business, please keep your microphone on mute until we begin taking questions. So if you are not speaking or asking a question, just double check, make sure you're on mute. Sometimes background noises can come into play here and be a little disruptive on the Zoom sessions. If you are having issues with connecting to the webinar, please call in and mute your phone. Excuse me. As I've already mentioned, please introduce yourself in the chat feature with your name, your organization. And lastly, please check your Zoom name and ensure that it's the correct name to identify you, because we want to make sure that we have the right person, the right name with the face. So check your Zoom feature. I'd like to mention that at the end of this, at 3:30, when this is over, we are having a raffle. And that raffle will be held for a special prize. And if you are here, you'll need to be here to win. We'll be offering that up at the end of the session. So hang in there till the end. We've got some really great information. We've got some really great prizes. We've got some good stuff going on today. A great speaker. I'm excited to hear what we're going to be presenting, and a great group of people. So to start off talking about some of those great groups of people, we have our ACEs Aware Kings collaborators. These are the people that are producing this event, that are putting all this together, that are part of the grantee package. With funding from ACEs Aware Kings Collaboration is the California Health Collaborative, Kings County Department of Public Health, King's Partnership for Prevention, and Kings United Way. We very much appreciate the work that all of our partners who have committed to moving this work forward to improve the health and well-being of individuals, families, and the communities in which we live. And this group of people I'd like to introduce here. We have Everardo Legaspi, who's the program manager of Kings County Health Department. Daisy Lopez, she's the senior director of the California Health Collaborative. Linda Baggio is the program manager at California Health Collaborative. Myself, George Yagetic, I'm the training and engagement facilitator at the California Health Collaborative. Nanette Villarreal, who's the executive director of Kings United Way. Erica Lopez, 211 coordinator at Kings United Way. Julie Lafee is the executive director at King's Partnership for Prevention. Karina Cazares is the office administrator at King's Partnership for Prevention. And lastly, Cameron Jones is the communications coordinator at King's Partnership for Prevention. All part of the collaborative. So our agenda today is as follows. We're going to begin our presentation in just a moment. Our presentation will go for just about an hour, at which point we'll have time for round robin discussions, questions, discussion points that you'd like to bring up. At 3:20, just before we finish up, we're going to have a presentation by Kings United Way 211 and some of the resources that they have available to us. And finally, we're going to end with a raffle just before 3:30, at which point the presentation and our network meeting will be ending. So to start off with, I am very honored to introduce Tammy Blackard-Cook. For more than 25 years, Tammy has worked as a licensed clinical social worker specializing in trauma therapy with adults. She holds a master's degree in social work from the University of Chicago. She works interactively with clients from a strengths-based and resilience-based perspective. She's trained with Brene Brown to become a certified Daring Way facilitator in Brown's The Daring Way work. In addition, Tammy is a certified practitioner in the Trauma Resiliency Model, or TRM, which is a mind-body approach that focuses on the biological basis of trauma and the automatic defensive ways that we human body responds when faced with perceived threats to self and others. For the past several years, Tammy and her colleagues have been working on, reflecting on, and practicing how to become more anti-racist in practice and how to understand the impact and influence of whiteness in their lives and the people they work with. In 2020, she helped start an online group where white and BIPOC people gathered together to delve into somatic abolitionism, which is loosely defined as a way of healing from racial trauma in both white and BIPOC bodies through individual and communal practices that collectively build resilience, discernment, and the ability to tolerate discomfort that comes with confronting the brutality of race. For her, the process of understanding whiteness, deconstructing whiteness in herself, and working towards healing racialized trauma is lifelong. And on that note, I'm going to offer up the share screen to you, Tammy, and thank you so much for presenting for us today. Everybody, if you give a big round of applause to our presenter, Tammy Blackard-Cook.
Hello, you guys gonna have to bear with me for a second. All right, okay. So Linda and George, if you guys can't hear me or anything, I'm not gonna be able to see you because I'm gonna be looking at the screen. So if you guys have questions or anything, just chime in, okay? Because I'm gonna make this small. Okay. So I wanted to start. I really actually hate not being able to see you guys because then I feel like I'm just talking to no one. So I'm going to try to have my slides up on one side and then talk to you. We have a lot of information to get through, but basically I'm located in North Carolina, and I kind of do volunteer work mostly for Resources for Resilience. They are a group out of Asheville, North Carolina that created this model, which is a public health model. You guys are in California. Some of you might have heard of the community resiliency model. I wish if I could, I would ask you to raise your hands, but I don't really know how to do that, so I'm not gonna. But this is I don't want to say based on that. They're all based on the same neuroscience and the same principles. And Resources for Resilience just added a few other tools to the public health model to help address the crisis of ACEs. And I did ask the Linda, George, and the other folks on the call before most of you got on about how much you know about ACEs. So I'm kind of assuming most of you already know about it, but I'm going to let us watch a tiny little primer on ACEs. And most of the time we're going to spend talking just a very high level overview of the Reconnect for Resilience model, which is again, public health model, which means everybody can learn it, everybody can teach it. They've taught this across the state of North Carolina to many, many schools. We've taught it to teenagers who teach other teenagers. You don't need to be a public health or mental health professional to learn this, to teach this. It's for anybody. That's what I love about it. And the reason myself and some of the people in our practice here started to really get involved in this is because, you know, as mental health professionals, that's what I do. I can only see one person at a time. But with this model, we can teach people like in large groups about trauma, about what it means, about what it looks like, and about how to heal and to increase our own resilience. So basically the model is going to help us understand how our body and brain respond to trauma, going to help you guys, give you an idea of how to claim your ability to reset your own nervous system. And one of the pieces that I really have liked that Resources for Resilience added was this ability to increase connection and compassion. And we teach those skills. So okay, you guys, I keep getting stuck because the pictures are I apologize. I'm not the best at this. George, how do I move the pictures? Because I can't get to the slides.
On the bottom of the screen?
Yeah, the pictures are on the bottom of the screen, and now I don't have any other. I tell you what.
If you move your cursor, and on the bottom of the screen, there's a box that will show up. Move your cursor over to the left.
Okay.
Oops. There we go. There's or you can use your arrow keys.
Yeah, it's not letting. Oh, wait, there. Thank you. Got it. Okay. So when we talk about resilience, I have to assume, actually, that most of you guys have heard a definition of resilience. Resilience is sort of how we begin to address the public health crisis of ACEs. And resilience, simply put, and we have a much longer way we talk about this in the full 2-day training, but resilience is when our scale tips towards the positive, even if we have had really hard things happen in our life or are still happening in our life. I'm going to talk a little bit more about that. But before we get into the resilience building skills, we were going to show this ACEs primer. And George, I don't know can I show it to everybody? Can you guys see that?
Yes, you should be able to. If you go ahead and click on the link.
Okay. I'm going to click on the link.
What does your parents' divorce have to do with your risk for heart disease? If your mother had a drinking problem when you were growing up, are you more likely to suffer from depression as an adult? Here's what you should know about ACEs. ACEs stand for Adverse Childhood Experiences, extremely stressful events that can happen to a child growing up. Some experiences are so stressful that they can alter brain development, as well as the immune system, increasing the risk of lifelong health and social problems in adulthood. The term comes from the Adverse Childhood Experiences Study, landmark research that shed new light on the root cause of everything from stroke and liver disease to substance abuse and mental illness. In the late 1990s, an epidemiologist from the Centers for Disease Control and a preventive medicine doctor at Kaiser Permanente set out to understand the association between childhood experience and lifelong health. They asked over 17,000 people in the Kaiser Health Plan in San Diego about their health history, as well as difficult questions about their experiences growing up. Anda and Felitti tallied up 10 different kinds of adversity in this largely middle-class and college-educated population. They were stunned to see how common ACEs were. 21% of all respondents were sexually abused as children. 19% grew up with someone who suffered mental illness. 28% had been physically abused. And 2 out of 3 respondents had experienced at least one ACE. The researchers next looked at how someone's ACE score, or the number of adversities they experienced, related to a wide array of serious health and social problems. They saw that the more ACEs someone had, the greater their risk for poor outcomes compared with someone with no ACEs. Someone with an ACE score of 4 had twice the risk of heart disease and cancer. Someone with an ACE score of 5 had an 8 times greater chance of being an alcoholic. And those with an ACE score of 6 or more, on average, died 20 years earlier. With every major problem they looked at in the ACE study, the risk went up for each additional adverse experience in childhood. As Dr. Robert Anda says, what's predictable is preventable. It's important to remember that ACEs are not destiny. ACEs are a tool for understanding the health of a population as a whole. For individuals, an ACE score can be a tool for understanding their own risk for health and social problems and empower them to make changes for themselves and their children. ACEs tend to get passed down from generation to generation and are common across all income levels, races, and cultures. But increasingly, people of all different professions and backgrounds are coming together to discuss how ACEs affect their communities. They're finding new ways to treat and prevent ACEs. Many doctors are starting to screen their patients for ACEs as part of their medical history. More schools are becoming trauma-informed, considering the source of problem behavior when disciplining their students, instead of immediately suspending or expelling them. To learn more about interrupting the cycle of adversity and improving health and well-being for the next generation, please visit kpjrfilms.co.
Okay. Okay, you guys, give me a second. I wish my technology wasn't so. Now, okay. George, I'm having trouble getting back. I should have let you do this.
You click the escape button on your keyboard to see if that works.
I am, and it's okay. It was just being persnickety. Here we go. Okay. So I know a lot of you guys, maybe you've seen that before, and I wish, again, I could see you and you could tell me if you've seen that ACEs primer before. But the Reconnect for Resilience, basically what we teach in this are skills to help people, including ourselves, stay well when we're going through toxic stress, or if we've experienced toxic stress. I mean, most of us have experienced stress, obviously stress. And it gives us something we can actually do about ACEs. One thing I wanted to say about, giving the ACEs test to everybody that comes in, whether you're working in a mental health facility or whether you're working in a primary care hospital, whatever your organization, whatever you're in, I never give that test without also giving a test that measures someone's resilience. I think there's one called the Devereaux Resilience Scale, and that scale you can give to adults, and it basically measures what practices people are engaging in right now that help them be resilient and how they can grow those. I always give not just ACE tests to a client, but I also will give benevolent childhood experiences. What were good things that happened when they were young, and also that scale that helps people assess where they are and how they can increase and do things that will help buffer the effects of ACEs in their life. And I can, if you've not heard of those, or if you don't have a copy of those, I'm happy to send those later. And the conceptual framework with the Reconnect for Resilience model, and again, if any of you guys have had the CREM, the Community Resiliency Model training, you've probably seen something like this before. So the conceptual framework is that we all have a resilience zone, right? We all have, sort of like a place where we feel like we're doing our best, or at least that we've got this, right? I can go through my life, I can go through my day, and I can get things done. You know, maybe I'll have, when you see here, I don't know if you can see my pointer, but I may have a charge at the beginning of the day. Like maybe my kid made me a little annoyed that morning, but it didn't kind of bump me out or make me angry or anything. It was just like, oh, okay. And you just kind of go through day. You can sort of handle whatever comes your way. That's your resilient zone. It's sort of like your okay zone. It's not necessarily your happy place, but you can handle whatever life throws you. Our brain is online and we're able to make good decisions. But as we all know, and this is what happens with ACEs, we can get bumped out of our resilient zone. And we all go here, right? We all have a resilient zone that's unique to us, but we all get either bumped out onto high, which we call the amped up state, or we get bumped down low, which is more shut down state. This is the human condition. And when you look at this slide and you look at it says a jolt or a threat, I mean, that can be something big like the ACEs, like abuse or neglect, but it can also be, I haven't been sleeping well. There's a lot of, things going on in the world right now that are scary and unknown. I'm not sleeping well. I'm not eating well. And let's say I wake up in the morning and again, it was a night with very little sleep. I didn't have time to make breakfast before I had to run out. I actually had to take a kid to school. Let's just pretend this is pre-COVID times. And, we're fighting before we get in the car. They get in the car with me. We go on our way to school. And after all that, like somebody cuts me off. Now, normally I would probably stay. I'd be okay. I'd be able to manage a lot of that stuff. But if I've had just a bad morning and I haven't had sleep, I haven't had food, I haven't been able to get along with people in my own house, and one more thing happens, like somebody just cuts me off in traffic, I could very well, I'll tell you right now, I will get bumped up into the amped up zone where I'm probably going to be angry. I'd probably yell. I'm getting that, I'm getting a rush of energy. It's just like one thing too much. So that jolt or threat can be something big. It can also be something small if you're, kind of, your resilient zone is feeling kind of narrow because you're not in the best place in your life. And I'll tell you what happens with me and with a lot of people, that what I've noticed is a lot of us tend to just say we're having a bad weeks, or someone who's had a whole lot of trauma, or who is living in a lot of chronic toxic stress, they tend to sometimes live up here in this amped up state, this anxious, hyper. It can feel anxious, it can feel hyper, it can feel panicky, it can be sleepless, it can be angry, rageful, hyper vigilant, constantly on the lookout for danger. You can also feel pain with it. They might live up here a lot, and I bet you know people like that, or you've been that person. And I know for me, if I'm in a state where I'm in this place for a long while, what will happen to me is that eventually I think my body just gets tired and it goes, and I plummet down to here. So I'll go from feeling amped up to feeling really shut down. Just like my body doesn't have that much energy anymore, and it just kind of shuts down. Where in the shutdown state is feeling more helpless, sad, exhausted, more of the depressed state that people think about. Feeling pretty disconnected, foggy, withdrawn, numb, a lot of numbness. And you can also feel pain in the shutdown state. And the goal of all of these tools that I'm going to talk, well, I can't talk to you about all of them, but with some of these tools is to, when we're in that state, in the amped up or the shutdown state, those are fine places to go if we are truly in danger. If there is truly a tiger on my tail, I want to be in the amped up state. I want to be able to run away. I need a lot of energy, right? Or if I'm, let's say, how sometimes deer get caught, or have that sense of being a deer caught in the headlights, they get stuck in a freeze state. And that's actually supposed to be very adaptive, where they're where they're supposed to be more safety for them. But Anyway, I mean, we need both of these zones. They're very helpful to us from time to time. But when we start living in the amped up state or the shut down state, that becomes a problem because we want to live in our resilient zone where we can connect with other people. And the resiliency tools that I'm going to talk about help us get us back in that zone. Okay. I am not going to talk about all the skills because we are not going to have time to talk about most of these skills today. I am going to talk a little bit about the sense-in skill and some connect skill and maybe some rapid reset skills. But this is like a 7-skill model. And I would be happy to talk to you some other time about all of them, but today we're going to do a really high overview. So one of the first skills we talk about other than sense-in is this idea of co-regulation and self-regulation. And so the skills that we teach are a combination of both of those things. And co-regulation simply means, getting back into balance with the help of somebody you trust. I think of a small child who's skinned their knee and they come over to their parent, right? And they're crying and they're upset. They're looking to that parent to co-regulate, to help them get back into balance because they're really upset. But we do that too. I mean, that's a human thing that we all do. So some of our skills are about co-regulation and some of our skills are about self-regulation, where we can learn how to get into balance on our own when we can't connect when we need to. So I'm going to assume a lot of you guys, and I don't know if this is true. I wish I could, again, see you and talk with you, but we're going to look at the brain in a very broad base, right? We're going to look at it, we're going to make it very simplified, overly simplified. We're going to look at it in 3 parts. And part of learning how to get yourself back into the zone is to understand how your body and your brain are built and wired. So we're going to start with the survival brain, which is the oldest part of our brain. And it's the part, in the back where your brain connects to your spinal cord, right? It's the oldest. It is our model, or this model is a bottom-up model. So meaning we're going to start working with the oldest part of our brain first, going up to the thinking brain last, which I'll explain more in a minute. But a lot of models, or when we talk about trying to help ourselves get back in our resilient zone, we go about it the other way through our thinking brain. So let's circle back. We're going to go to survival brain. Reconnect is a bottom-up model. And this means that we're going to use the survival brain to regulate our system. That's our goal. The survival brain is in charge of all the things that we can't control consciously. All the sensations of our body, our automatic body functions like our heart rate, our breathing rate, our reproductive system, our digestive system, and it activates or mobilizes those survival responses. So our survival brain, we have no control over it. It's mighty powerful though. And our emotional brain, survival brain, we don't have to think about any of that stuff. And it's a good thing because it keeps us safe. We don't want to have to sit and think about it if there is a tiger chasing us, right? Our emotional brain is actually one of the things I've learned through studying this model more is that it's developed through connection with others. And our emotional brain helps us interpret the environment based on our memories and our experiences, our previous memory, our previous experiences, our memories of when we were younger, things that have happened to us. Our emotional brain's in charge of feelings, our sense of attachment, like how close we feel to other people. And we kind of helps us respond based on memory. Do I like chocolate chip cookies? Yes, they make me feel warm and happy on the inside. I love them. That's a good memory for me, right? That might not be true for everybody. But one of the most important things about the emotional brain, at least as we teach it in this model, is that it's always also, there's a part of it called the amygdala that is constantly assessing for safety or threat. That is its only job, is to assess for levels of safety or threat. So we're going to remember that because we're going to come back to that. And the thinking brain is the newest part of our brain. It's the front part, sort of right behind the forehead. And it is, I think, what most of us in Western culture kind of identify with as our brain. You know, it's the part that we think. We can do critical thinking. We can do our executive control functions like planning our day, making lists, et cetera, et cetera. It's the seat of language. It's also what integrates parts from all three of our brains. Kind of helps us make sense of our emotions and the sensations we get from our body. So the amygdala, I mentioned that part is in your emotional brain. It's always assessing for safety and threat. So think of it as working like a smoke detector, and it signals to other parts of our nervous system when either safety or threat is detected. When it signals that there is any sort of threat, it is going to send a message to our survival brain, threat. And if I wasn't doing this in person, or you could see me better, I would be doing that hand brain model, which I'll send you a link to that at the end of this if you want. But the emotional brain, the amygdala, sends a message, threat. It sends a message to the survival brain. You need to fight, flight, fight. Help me there. Fight, or flee, or freeze. So it's telling our body what to do. And once that, actually, I'm also going to say, once that signal is sent out and the survival brain starts to give all that information to our body to get ready to flee or to fight or to freeze, our thinking brain goes offline. We really cannot think, and you don't want to think when you're in serious danger, right? Okay. I love this slide just because I think it's really helpful to help understand this a little bit more. This is a PET scan of two brains. The healthy brain is on your left, and an abused brain is on the right. That's actually a brain of a Romanian orphan who unfortunately was institutionalized shortly after birth. So they didn't get very much actually connection with other people. It didn't get a lot of touch. So what you notice, this is what I want you to notice in these two slides, is that the healthy brain on the left is developed all over. Okay, the front, like where your eyes are, that's the top. And the back of your brain, where your survival brain is, that's the bottom of this picture, okay? And red means more activation. So the healthy brain has more activation all over. It's like nicely developed. It's got a lot of integration, and you can see that thinking brain is lit up, right? Which is a good thing. The abused brain, on the other hand, you see where the circles are? It's I think they're trying to show areas of the emotional brain, or at least pieces of it, your temporal lobes and that kind of thing. There's just not much there at all. There's hardly any activation on that abused brain's PET scan. It's very shut down. It would be very hard for that child to actually develop connections and feel safety with other people because it hasn't had enough interaction. And where you do see the most interaction on the slide is the survival brain, which is unfortunate because really what that means is they're probably stuck on high alert a lot. Okay. So I know I'm going fast, but this is what our skills are all about. To restore balance to our nervous system, you got to signal safety to the survival brain. That is the shortcut to helping us be more resilient. But if language is in the thinking brain, what is the language of the survival brain? Again, I can't talk to you guys, so I can't tell you, but it is sensation. So when you try to talk to your survival brain, it's going to sound like the Charlie Brown, teacher. It won't compute. The survival brain only understands the language of our body. So we're going to focus on sensations. this is where we always start in this model. And that's that skill, if you remember the circles, the skill of sensing in. In the CRIM model, it's called tracking, but it's the same idea, that sensations let us know when we feel safe or when we are not safe. And this sounds very simplistic, but it's surprising to me still, as much as I've taught this and as much as I teach clients on a day-to-day basis, how hard it is for people to slow down enough to actually notice what are sensations in their body. So they're physical feelings in the body. They're not emotions. I mean, often people, I'll say, what are you sensing right now? And they'll say, I feel happy. And I'll say, okay, well, how do you know you're happy? Where do you feel that in your body? It's something we have to teach, because I don't think we don't think like this very much in the United States. And our nervous system is beautifully wired to detect this. We do have ability. We have a beautiful, amazingly developed nervous system. And we'll take every piece of information we can get when we're trying to get someone to get into their body: sight, smell, taste, touch, sound, gut feelings, muscle aches, joints, anything. So what are sensations we can notice, right? So just take note of this, because the first three things are easier for folks. So I might start there if I was teaching, especially like a kid or honestly anybody. But muscles, tense muscles or relaxed muscles. Breathing, is your breathing deeper or shallower, faster or slower? How's your heart rate? It gets a little harder for people when you start talking about temperature. But if they practice, they get better at it. If they notice pressure or vibration, sometimes if I can get very, very still, I might notice, for lack of a better word, it does. It feels like vibration. But you have to get very still and quiet sometimes to figure this, to notice this. And asking people, where do you notice this? You know, if I say, I feel a pressure, where do I feel that pressure? Well, a lot of times I might feel it on my chest, or maybe the back of my neck, that kind of thing. Balance sensations. These are really important to notice, and these are the ones we don't notice. It is much, much easier for us to notice things that don't feel good, because our brain is wired to have a negativity bias. Much easier for us to notice things that feel bad. It actually takes practice for us to notice what is feeling better. And what we know from the research is that balance sensations are things like, I see somebody take a deeper breath, or they might notice their heart rate is slowing down, or that maybe their muscles and their shoulders just relaxed a little bit. And maybe their voice comes down a little bit and they feel more grounded. Like, I can tell you right now, I'm starting to feel more balanced, because I'm always nervous when I'm giving a presentation. And I can start to notice I'm starting to relax a little bit more as we get into the presentation. And these balance sensations, from your perspective, from the people you work with, they're so important to look for. The best examples I can give you are balance sensations are signaling when the nervous system is coming back into the resilient zone. And now that I've been doing this for so long, like as a therapist, but just as a person in the world, I do it with my kids, I do it with myself. When something's happening and I am feeling really amped up, or if I'm feeling really shut down, I will think, because I'm used to now sort of noticing the sensations in my body, I will often think I need to do something, or I think I'm going to bump out of I think I'm going to lose it. I'm going to get amped up, right? So I'll do a skill, and what I'll do the skill just to do the skill. But what still to this day kind of amazes me is that I'll do a skill and I'll sense into doing it, notice how my body's feeling, and then my body will automatically take a deeper breath. I have, I'm not doing it on purpose. It just happens. And I notice that deeper breath. And then I am like, oh, okay. I noticed I took a deep breath. And then I might notice my shoulders drop a little bit. I see this happen all the time with clients. A couple of clients in the last few weeks that have had a lot of panic going on because of all the things going on in the world, the Capitol and everywhere else. So they've had some panic attacks. I've had people have panic attacks in the middle of sessions. And one of the skills, which I'm not even sure we're going to get to today, is for people to stand up and push on the wall if they're starting to feel that panic, which is the amped up energy, right? Way too much energy or way too much anxiety, usually shallow breaths, heart racing, that kind of thing. And you can start to see it happening with somebody because you see it on their face and you see them get more like, I don't know if you guys can see me or not, but you get more like this, just more hyper vigilant. So what I've started doing, especially with Zoom, because I'm not in the room with them, I'll say, I want you to get up and go push on the wall. And I want you to push as hard as you can so that you can feel your big arm muscles, engage, and feel those muscles engage. I've done this so many times with people when this is starting to happen for them, and I'll just talk them through it. I can do this with a kid. I have done this with kids. Notice your muscles. Notice the push on that wall like you could push it over. It's not going anywhere. So we'll push and we'll push. I have them keep pushing until I see them take a deep breath. And then I say, did you notice you just took a deep breath? And then immediately I see their anxiety come down. Okay. So I was hoping we could do this. I want just to do a couple of exercises here. First of all, I mean, if you're at all interested in talking, if you could unmute for a second, and I want us to do like rubbing our hands together as fast as we can and as hard as we can. Just do it and then I want you to stop and just pay attention to the sensations on your hands. Mine feels really tingly. It's like popcorn. People just tell me, what do you notice in your hands? What sensations?
I feel warm.
Warm, hot, tingly.
Hot, tingly. I think somebody else said something. I couldn't quite hear it. Okay, well, let's do this one. So now we had this picture, but just take a look at this picture. I just want you guys to popcorn. What do you notice happening on the inside of your body when you look at this picture? If anything.
I feel a little cold, but that could also be because my environment was cold. And so this picture reminded me that I'm cold.
That you're cold, okay. So, and where do you notice that? All over or a particular place?
In my arms.
In your arms, okay.
Chills on my arms, same thing.
Chills on your arms, that's so cool. Anybody else?
A peacefulness or quietness.
Yeah, a lot of times when people, where do you notice that peacefulness and quietness in your body, if you had to say?
In my head.
So sort of up here in your head?
Yeah. Yeah, and it's like an emptying, a widening of my head.
Okay, oh, that's cool. So like yeah, I know what you mean, because I loved hiking. What about this picture? What do you notice? I noticed a smile on my face.
Comfortness.
What was that?
Comfortness.
Yeah. Where do you notice that comfortness?
I just felt like a sense of comfortness, just all over the body.
All over the body.
I felt it right in my heart. I felt it right in the middle of my chest. Kind of this like feeling of like tightness being undone. If that makes any sense. Like it just kind of
yes.
calmed.
Yeah. Just like expanding a little bit, maybe.
Yeah, just kind of like warmth came across or something like that.
Okay, and so just notice that when people are talking about what they're noticing, assuming they're positive or balanced sensations, just draw their, so just notice that warmth, notice that expansion. Because we do not pay attention to what feels good. So, I mean, I don't know if I'm misinterpreting what anybody's saying, but everything I'm hearing so far is good. Yeah. So let yourself pay attention to that because it matters more than you realize. Okay, I'm going to move on because I'm realizing time. So that sense in, we were just doing sense in, and we spend a lot more time practicing that because just like everything else, the way we learn is by practicing something over and over and over again. And now when I'm starting to feel amped up or shut down, I start to notice the physical sensations and I know I need to do something about it. And it's what I teach people I work with. So that's the sense in skill. And we use the sense in skill. It's so powerful and we use it with every other skill. We don't do anything without sensing in. And I just talked to you a little bit about rapid reset, but rapid reset is when the amygdala has said there's a tiger on your tail and the alarm has gone off and you're in full like panic mode. That's usually when we use rapid reset, when our thinking brain's pretty much offline or about to be offline. Those are the calm down quickly, pull it together skills when we're out of balance or to help others when we need to. And it's anything that brings any kind of positive or neutral sensory awareness into the present moment. Because when you're, stuck in that amped up state or even in that shut down state, nothing feels good in that moment. And your brain is convinced something's really wrong, even if you're just having a panic attack and there's nothing actually going on in that moment. Or something reminds you of something that was really bad that happened to you, but it's not happening to you right now, but you've been triggered to think about it. So a good example I always give this example for myself. When, and this is one of the times I was like, wow, these tools are so powerful. One of my best friends had a spinal cord injury about 4 years ago. And it was really bad at first. She's fine now. She can walk and everything, but we were not sure about anything in the moment. And I got a call while I was at work and I was waiting for a client to come in. And it was her husband and he started crying and I had to go get their kids and just all this stuff happened in this split second, right? Well, I work at a place where we're all trained in this stuff, luckily. And I remember kind of walking around the halls going, I don't know what to do. I don't know. Should I go to the hospital? Should I go pick up the kids? I don't know what to do. And I was completely amped up. And one of my colleagues who teaches this stuff sometimes, she knows me well enough to do this. You don't just put your hand on people's shoulders. You guys probably know that, unless you know them well enough. But she put her hand on my shoulder and she said, Tammy, can you feel your feet on the floor right now? Which is a rapid reset skill, which is a grounding skill. And I said, oh my God. Okay, right. Okay, feet on the floor. I took literally, I would say 2 seconds and took my brain, noticed my feet on the floor, kind of moved my feet around so I could really feel them on the floor. And I took a deep breath, not on purpose, but I noticed my feet on the floor and I went, okay. I said, I need to call my client and then I need to go get the kids. And then I was immediately, it was just like my brain had been offline. She said, can you feel your feet on the floor? And I was like, oh yeah, okay. Body, remember, there's not a tiger right there. You actually need to think this through. Thinking brain went back online and I was able to plan about what to do. I still am amazed that was that effective that fast, but it was. So other rapid reset schools, I just explained the one about pushing against a wall right? When you're engaging those fight muscles or flee muscles, it's just using all that energy that you have going to get it out, and it helps your body reset. Take a sip of water and notice as it goes down your throat and into your belly, just noticing it, just sort of like having any sort of sensory awareness for right now. Take a walk, take a run, and notice what it feels like as you're doing that. Sing or hum. That's a great one, because it also helps regulate our breathing and make our breathing deeper. Do heavy work. You can make up anything you can make up a lot of things for rapid reset. People have been very creative. For example, the heavy work at some schools that we've taught this model to, when they teach the kids, some of the teachers now will keep stacks of heavy books in the library in their room, just so a kid who's starting to get real amped up, or maybe who's real shut down, and they're just not able to attend in class, and they're just sort of, the teacher can tell they're about to not be in their resiliency zone, or they're not in their resiliency zone. She'll say, Johnny, do you mind taking that stack of books to the library for me? And so Johnny will pick the books up and walk them to the library. And all she's doing is having that child do some heavy work to reground them and to get their bodies to get back in their resilience zone. So the librarian knows that's what they're doing. So they just bring the books there and drop them off. And the teacher comes back and gets them another time, and they'll use that as an example, or that they'll use that as a rapid reset tool. It just helps give us somewhere for that fight or flight energy to go, to do. And it helps tell our brain where our body is in space and time, and that there's no threat. And I hope that makes sense to you. We do talk about that a lot more in the bigger training. And the thing that really helps, like I said before, and I'm going to say it again, is to get them to notice. So I pick up the books. Johnny, did you notice how heavy those books are? Look, your muscles are holding those. That's a really good job. Can you take those to the library for me? Just to bring their attention to the sensation. I actually use rapid reset all the time in meetings. If I'm watching the news, I might push my feet in the floor while I'm sitting somewhere if I'm getting upset about something, just to help bring myself back down a little bit. Okay, I think we talked about that. And this was the last thing, I think, one of the last things I wanted to talk about. I know I've gone really fast, so I would like to leave a little bit of time at the end. When we think about survival responses, I know I did for forever. I only thought about fight, flight, or freeze. And really, and this is from the work of Stephen Porges, his research, we actually have other ways of responding to threat. And we have this pyramid of automatic survival responses. And these are in the order that we use them, okay? So our newest survival skill is connect. That's the one on top. That's the one we're going to try first. And of course, we're not consciously thinking this. We're not making a decision. It just happens. We're going to go to connect first. If that doesn't work, fight, flight. If that doesn't work, freeze, submit, collapse. Okay, and I'm going to explain these a little bit. But the first line of response is to always connect to create safety. So you know how you walk into a room, and actually I was doing this when we started, where, well, at least if I have to talk, or even if it's just, I don't have to talk, but I'm just going into a room of strangers, I might scan that room to see if anybody looks friendly. Like, who do I want to go sit beside or try to go strike up a conversation with? Or like if I'm doing the training and I might look for familiar faces, like in all of you. So that just helps me feel a little bit better. And that is a survival response to connect, that connection, that co-regulation strategy. But many times connection, not an option. We can't do that. So for our own, this is like not even a second long decision. It's like connect, nope, doesn't work, go to fight, flight. And if you think about fight as more than just fists, especially well, not especially really in any setting, but I think of schools a lot. It's not just fighting, it's also complaining, competing, being defensive. And flee is more than just running away, right? It's also avoiding. I do that. I can do that really well. Avoiding, absenteeism, not showing up fully because it's just too much. So I'm like kind of like half checked out. Um, or being on your phone all the time just to stay distracted. And if those won't work, then we go to fight or freeze, submit, collapse. And those are the last line. That's the oldest survival mechanism. And I know we think about freeze. We've often heard about that deer in the headlights. And if you think about freeze as it's like all the energy of amped up, which we call the gas pedal. It's all that energy in the system is freeze with a brake pedal underneath it. So that deer is standing there in the headlights, unable to move, but on the inside, there's a world of panic going on. So it's gas and brake, freeze. Okay. If we can't fight, we can't flee. Submit is when the body takes it, takes whatever's happening because there aren't any alternatives, or an alternative would be too dangerous. You can think about that as negotiating with an attacker or an abuser. You can't get out of it. So how do I survive this? Right? And then collapse is the very last ditch effort of the body to survive despite the odds. And an example we have with someone who teaches this model here in North Carolina, and there's a lot of examples, but they're a little bit harder for me to pull on. But this example is someone that we work with is in a kayaking accident, and they were underwater for 6 minutes, and they didn't have any lasting brain injuries or brain death or anything, which was really surprising and shocking. But the reason is because their body went into a collapse. So if you think of freeze as, gas pedal brake, there's a lot of stuff going on in the body, but it doesn't look like it on the outside. Collapse is not much going on, period. People can faint. Heart rate drops way, way, way down. Everything in the body slows way, way, way down. And so because of that, he didn't need as much oxygen and he didn't have any brain damage. It was an amazing survival technique that our body has developed. Okay. And I do wonder, I'm just going to read you a little bit of this. How we can using this chart to kind of make sense of our own behavior and that of other people that we work with or kids. So we can't talk about this much. I'm just going to read this. How intergenerational sexual abuse cycles in families. And I know we've seen this. And often it's related to a not protective enough parent actually being in a freeze state or a partial freeze state, despite wanting nothing more than to not have their kid go through what happened to them, right? Or how kids living in amped up energy, constantly stuck on amped up, from trauma, come to school and act out or fight or flee. Why the kid just throw the desk across the room, or why they just run out of the room? And our system doesn't handle that well. We punish those kids, but that kid is reacting from all that energy that's in their body. And if we had a different response, I think we'd have a lot of different outcomes. And the last thing, one of the things we talk about a lot is the shame that we feel because maybe we were in freeze or submit, but that is actually how our bodies are wired. There is no shame in it, but we feel that anyway. Okay, so, and we just brought this back up again because the amped up state and the shut down state are those survival energies just too high. So if you think of amped up as fight, flight, shut down is freeze. You guys got to help me. I don't have my slide for freeze, collapse, submit. So I don't know if that helps you, but it helps me a lot. If I could put them side by side, I would. Those are those energies, and the skills help us get the energy out of our bodies so that we can come back into our zone. I think I might stop there. What I was going to say about the connect is, for example, if you're working with the kids or adults, it doesn't matter, honestly. Before you connect, before you correct, okay? In fact, I'm going to put the other slide up first. Connect before you correct. So regulate was the co-regulation, come together, connection, and you're relating into that person to help them get back in their zone, whether it's a kid who's misbehaving or whatever, and help that kid understand, okay, I don't have to agree with the behavior they just had, but okay, that makes sense to me because you were feeling XYZ or whatever. You're relating into that child or to that adult. It makes sense to me why you did this. Doesn't mean I liked it, but it makes sense to me. Because until you can get them back in their zone, you're not going to be able to have a conversation, to be able to reason with them, because their thinking brains are not online. And the good news about ACEs, which is hopefully what I've been talking about, is research that shows us that experiences, no matter how brief, of people who helped us, believed in us, or cared for us can buffer the effects of ACEs. And if we can get people to tune into their bodies and sensations when they are connected to other people, and they can feel that that feels good, that can just deepen their experience, help them experience safety, and give them the opportunity to connect with the next person. So those are all the tools, and that is it. And I was hoping that we could maybe take a, do I have to stop the share, you guys? I think I do, don't I?
Yes, actually, there we go.
Okay.
And I'll go ahead and reshare, open this up for questions. If anybody has any questions for Tammy at this point, go ahead and unmute yourself, or you can put it in the chat feature.
Oh, there's a lot of chats. Were there any questions in there?
No questions yet.
There are no questions. However, we have some very great responses on your presentation on the excellent information, that you are very informed, and butterflies in the stomach. And I would also add to that and say thank you so much, Tammy, for providing us such essential tools to not only help ourselves in our everyday lives, especially as we are facing multiple adversities at this time, but also when leading the community towards a resilient place.
You're welcome. I love talking about that. And thank you guys for having me.
Linda, can you hear me?
Yes, I can. Hello, Dr. Rodriguez.
Hi, it's such a pleasure to meet you. I've been staring at you, thought, should I put something in the chat for you and George now? I want to reiterate what you just shared with her. I believe I'm an ACEs expert as well. And I want you to know that your presentation, the manner in which you have delivered the information, is stellar. More than anything, you bring it at a level where almost anyone gets it. You know, if they've been to a billion trainings, your presentation was excellent. And I just want to thank you for your passion, your commitment, and every moment you put into developing even the presentation. Thank you so much.
That's so sweet. I feel that right here in my heart. I feel all this.
It's genuine. Trust that.
Oh, so good. Thank you.
Yeah.
You know, there's a lot of us here. We would love to get you guys in California to be able to do it too, because we do think it helps people, kids, families, us, everybody.
Thank you so much, Tammy, and thank you, Dr. Rodriguez, for that essential feedback. We would like to leave the room for any questions. If there's any requests for additional resources, Tammy is here to answer those questions and provide resources if needed. Her email was also included in this slide. So as you review the recorded presentation, it will be available to you to save that information and reach out to her if necessary. Okay. And if there are no questions at this time, the chat is fully open if anyone would like to pop any questions at any time. But now we'll be moving on to the next step of our presentation, which would be our 211 speaker, Erica, who is also a partner within this grant with Kings County. So I will leave the room for Erica to please take the stage.
Thank you, Linda. If we can please go to the next slide. So my name is Erica Lopez. I'm the 211 coordinator at Kings United Way. There's Annette Villarreal, executive director for Kings United Way. And we've been overseeing the new project we're bringing, which is the Community Information Exchange. Next slide, please. All right. So 211, it's a free 24/7 service that gives you information and access to community health and social services. The Community Information Exchange is a systems change that fosters true collaboration across networks, moving towards a person-centered intervention and interactions across healthcare and human services. So the goal of the Community Information Exchange is to improve health and wellness for individuals and populations. Okay. So as a service provider, this is a very helpful tool you can use to find local resources. 211 Kings County has several different ways you can access 211 and community resources. All the different ways to access 211 is free, available 24/7, and it is confidential. When you dial 211, you get connected to a live call specialist. Call specialists can provide information on local agencies providing services either over the phone or can also send the information to you through text. When calling 211, each caller is also offered a follow-up call to ensure that the caller was able to access services and to provide additional resources if needed. You can also text your zip code to 898211, where a call specialist can provide information on resources as well through text message. We also have where you can search our information on our database in both English and Spanish by visiting 211kingscounty.org, or if you're unable to find a resource and you'd like to speak to somebody or have a conversation with somebody, we do have live chat available on our website as well. We also have a mobile app called 211 Intellifull, very similar to the website 211 Kings County. Both display different categories such as legal, family, mental health services, and much more that can help guide you to information on programs in our database. So if we can please go to the next slide. So here's a slide of some mental health resources available on our website that can be helpful when connecting your clients to resources or trying to gather information for clients. In our mental health tab, we have a variety of resources such as hotlines, counseling, support groups, and much more. In the next slide, there is a short demonstration on how you can access our 211 website and these categories.
Visit 211kingscounty.org and find information on local resources. You can chat with the live call specialist. You can also search by text by clicking here and typing in the resource you like. You will then get a list of different programs available in the database. You can also search through our categories on the main page. Click on the category of your choice and get a list of subcategories in both English and Spanish. Click on a program, get information such as description, phone numbers, website links, location, and program deliveries.
Okay, so going into the next slide, what is the community information?
Kingscounty.org and find information.
What is the Community Information Exchange? So the Community Information Exchange, CIE, is a community-wide referral system that facilitates connections across multiple agencies and links patients and their families to needed services. So it's a resource database. It gives closed loop referrals as well as sharing client level data. Next slide, please. The core components of a CIE are network partners, shared language, as well as resource database and bidirectional referrals, technology platform, and data integration. These core components allow network partners to work together, as well as share client records, access resources, as well as make closed loop referrals. If we go to the next slide, there is a list of different, we have a Unite Us presentations coming up of different sessions. So if you're interested in learning more about the Community Information Exchange, I encourage you to join one of these sessions coming up. I will be putting the link in the chat box where you will be able to register for one of the sessions if you're interested. I will also be adding the link to the Unite Us website, which is a technology platform we will be using for the Community Information Exchange, so you can learn more about it. That is all for me. I will also be adding my email in the chat box. If you'd like to connect after the presentation, I'd be more than happy to connect with you all. Thank you.
Thank you so much, Erica, for extending that valuable resource for us, especially after connecting with Tammy's presentation here today. The next step is to allow you all to please take some time after this presentation, after this event today, to please go into SurveyMonkey using the link on the chat that I've provided, and please evaluate our event for today. One thing that I would also like to state is when you are completing this evaluation, if you could please pay attention to number 8 of that evaluation. The question will ask what organization hosted this activity. If you could please enter California Health Collaborative, that will truly help us with the tracking of these responses. Next slide. And also, we'll also like to call attention to some upcoming events that we have for our Network of Care events. Today, we hosted Dr. Tammy Cook, and for our next events that will be hosted on February 16th, we will have Dr. Alex, who will be speaking on perinatal mental wellness and impact of ACE. So that will be a truly exciting event, and we hope that we can all see you there. I would also like to call attention to upcoming events that will be held by one of our partners, Lupe. Lupe had also included in the chat earlier on upcoming events that will be hosted today at 4 p.m. Reflections and connections in these trying times for clinicians. So if you are a doctor, nurse, substance use disorder provider, and a behavioral health provider, we highly encourage you to connect today at 4 p.m. For this event, as it will be a gateway following this event topic on resilience. This will be an interactive half-hour pause in the day along with Dr. Jeff Ring to connect and interact together to address provider resilience in these trying times. And we also understand that there are some heavy topics that will be going on in the next couple of days, especially tomorrow. And we please ask you to please pay attention to these grounding tools that were provided at today's event to help support you and keep your body grounded. And now we will move on to the raffles for today. I will give this up to George to raffle up.
Thank you, Linda. And thank you everybody for making it through to the end. We have come to our raffle portion of the show. And what I'm going to do is just change screens here and pull that raffle up. Give me just a moment to go full screen here. We have one prize here for a lucky participant, and a fun way to find out who that is. Oops, let's try this one more time. Share my screen, there we go. Okay, now I hope everybody can see that. We've got all the people's names who are in attendance. Just as a quick reminder, for all of our network members, we are sending a box filled with a number of items to thank you for being a network member. Our raffle prizes, our prize winner will have an additional prize in that box that we will send out, and those will be going out at the end of this month. Sorry for the delay. We did have some backup over the holidays, but those are going out soon. So let's click to spin and see who our winner is going to be. And we have Patty Hayward. Patty, congratulations.
Thank you, George. George, may I ask, I won the first time. I'd like to give other participants a chance to get the gift, but thank you very much.
Oh, absolutely. That's very generous of you, Patty. So yes, Patty has won one time before. So we'll go ahead and we will spin again and see if we can select somebody who is new, somebody new to the network.
And Patty, we're hoping you could share your luck with us. You keep winning.
Yes. We have Dr. Jessica Rodriguez, our newtime member to our network today. Dr. Rodriguez, congratulations. You are the raffle winner for today's session. So we will make sure that that box goes out with that raffle prize. Keep an eye out over the next couple of weeks, and that should be at your door.
What is your feedback and what I should?
Oops, we have some feedback there. At this point, I'd like to just go around quickly and have everybody introduce themselves briefly. We've got a few minutes left before we close up. Let the network members know who you are, what organization you're with, and any comments you may have about today's session. And we'll go ahead and start with Dr. Rodriguez. Would you like to introduce yourself? I'll go ahead and call people out.
Thank you. My name is Dr. Jessica Rodriguez. I have On-Site Strategies. It is a national cultural hub. I also provide treatment and healing for ACEs children, ACEs adults. I've been doing it quite a long time and trained initially by Dr. Nadine Harris-Burke. And just appreciate the opportunity to be here and having been contacted by Linda and George. It was a great presentation. I'm so glad I carved some time out to participate today. Thank you.
Thank you, Dr. Rodriguez.
You're welcome.
Excellent. And Tensha Cazares, would you like to introduce yourself?
Hi, can you hear me? Yes. Hi, my name is Hortensia. I go by Tensha, last name Cazares. I'm a social worker with Aspiranet. We are a foster agency. I also teach ACEs and traumatic stress classes through COS to foster and adoptive parents. So this presentation was right in line with what I teach. Very interesting. Thank you.
Excellent. Thank you. Alexis Terrell.
Hello, everybody. My name is Lexi Terrell. I am the new Community Engagement Manager with Kings United Way, and I just finished my Master's in Social Work, so I'm going to be getting started on my licensure for something.
Excellent. Thank you. Jose.
Hello, everyone, and welcome. Thank you, George. My name is Jose. I am the ACEs Award Project Coordinator for the Child Abuse Prevention Council. I'm actually based out of San Joaquin County. I'm another grantee as well. So pretty much I just come to continue to show support, get some ideas of Kings County. We kind of bounce back and forth. If anyone's interested in learning more about it or anything like that, we do have our engagement session coming up on Thursday. I'll leave my email on the chat box if anybody wants any more information regarding that. Thank you.
Excellent, thank you. Sarah. Sarah Flores, would you like to go ahead and unmute yourself and introduce yourself? And all right. How about Patty Hayford? Patty.
Thank you, George. My name is Patty Havard. I'm a pharmacist by profession, and I have 32 years of experience teaching at academic centers, mostly as a basic science researcher and also as a clinical translational researcher. I've been at Kauai Delta for the last 18 months. I'm a grant and research specialist here at Kauai Delta, and we submitted a recent grant for ACEs. And to be very honest with you, I am not an expert at all, and I've got connected with Linda and George, and I've been attending the sessions for the past month, and it has been a fabulous learning experience for me, and also networking with learning some of the networks that's in the community. So thank you very much.
Okay. Well, I will do.
Thank you, Patty. Let's see. David Dooley, are you there? David, would you like to introduce yourself? And moving right along, Lupe Wong, would you like to introduce yourself?
Yes, so hello all. My name is Lupe Ponce Wong. I am formerly from Kings County. I was the Alcohol and Drug Program Administrator, but currently I'm with CalViva HealthNet as a Senior Health Education Specialist. And we are very actively involved in ACEs implementation. We've done over, I think 10 different trainings on ACEs to our providers statewide. We've done several updates to providers on different topics related to ACEs. We have several materials available. So if anyone's really looking for some resources for providers or some additional trainings, we have some coming up. And I would love to share those with you. George or Linda, let me know if you need me to send those to you again. But we are really working diligently, and we really believe in the ACEs work. And so, yeah, that's what we're up to. Thank you.
Awesome, thank you. And lastly, Renee Farias. Renee, would you like to introduce yourself?
Hi, I'm Renee Farias. I'm a community nutrition advisor for Dairy Council of California, which is a nutrition education organization. I learned a lot today during the presentation, and we are just learning more about ACEs and how we can use this information to better serve our clientele, which focuses on children and families. Thank you.
Excellent, thank you, Renee. Lastly, there was Anisha Kleinhammer, who was here, who had just stepped out. She's with Fleet and Family Support Center Counseling and Advocacy Program. She is a supervisor there. She was very happy with the presentation today and was grateful. Send some thanks. Let's see, the last before we close, we have some of our collaborators here. I'd like for you to go ahead and unmute yourself, introduce yourself, and before we close.
Hi, everyone. Before we go ahead and introduce ourselves, Jose, did you have an upcoming event that you would like to share with the group? We have one of our partners here who's also an ACEs Aware grantee who currently hosts Network of Care sessions as well. And I would like him to get some time to share that information with us if he would like to.
Hey, was that question directed towards me, towards the other partner? Okay, I was a little confused there. No, we have our January engagement session coming up on Thursday via Zoom from 2 to 3. if I put my email on the chat box just in case. I don't want to take up too much time, so just in case if anybody wants some follow-up information, I can send you over the flyer and the Zoom link. Once again, just like kind of like this collaboration, most of the resources for your guys is Kings County, so like the 211 and stuff like that. Most of the resources for the San Joaquin one will be for San Joaquin County. However, we are focusing on trauma-informed care, so that can be universal. So if anybody's interested about learning about the trauma-informed care aspect of ACEs and kind of the importance of it and why it mitigates ACEs, feel free to shoot me an email and I'll give you guys everything you need to get registered.
Thank you so much, Jose. Hello, everyone. My name is Linda Baggio. I'm the program manager with California Health Collaborative. It's wonderful to see you all here, and thank you so much for staying with us to the very last minute of this session. It means a lot to us, and I will extend it to the next partner. Cameron.
Hi, everyone. I'm Cameron Jones, and I'm the communications coordinator for KPFP.
Hello, everybody. My name is Erica Lopez. I am the 211 coordinator at Kings United Way.
Hello, my name is Sarah Flores, and I am the program coordinator for West Care Adolescent Services.
Hi, my name is Karina Casares, and I am the office administrator for KPFP.
Hi, and my name is Julie Lafise, and I serve as Executive Director of KPFP. And I just realized that I was still hiding from when I was eating my apple earlier in the presentation. So I apologize, I've been behind a picture for a while now. So good to be here, and thank you again for this fabulous presentation.
Excellent. Thank you, everybody. And thank you all for being here until the very end. We, at this point, are right at 3:30. Would like to thank you. We know your time is important and precious, and we hope that we have fulfilled our end of the deal and giving you some really good ACEs information. We hope you have a wonderful rest of the day, and we hope that the rest of the week goes smoothly, even with all the large events going on nationally. We hope that you hold on to your resilience, hold on to the fact of those things that keep you grounded no matter what happens, and get us through this week in a way that can buoy us forward as we move forward with our ACEs initiative. Thank you all for coming, and we look forward to you coming again next month.